blocks the blood vessel, and it will cause a heart attack if the blockage isn't removed. Variant angina is caused by a spasm in a coronary artery, causing it to temporarily narrow. This is a specific form of unstable angina that can occur at any time. No trigger event causes it to happen. Signs and symptoms. The painful sensation that occurs during an episode of stable angina is often described as pressure or fullness in the center of the chest. The pain can feel like a vice squeezing your chest, or like a heavy weight resting on your chest. This pain may spread from your chest to your neck, arms, and shoulders. During an episode of stable angina, you may also experience shortness of breath, nausea, fatigue, dizziness, profuse sweating, anxiety. Diagnosis. There are several tests your doctor may order to help confirm whether you have angina. Electrocardiogram, ECG or EKG. Each beat of your heart is triggered by an electrical impulse generated from special cells in your heart. An electrocardiogram records these electrical signals as they travel through your heart. Stress test. Sometimes angina is easier to diagnose when your heart is working harder. During a stress test, you exercise by walking on a treadmill or pedaling a stationary bicycle. While exercising, your blood pressure is monitored and your ECG readings are watched. Echocardiogram. An echocardiogram uses sound waves to produce images of the heart. Your doctor can use these images to identify angina-related problems, including whether there are areas of your heart muscle that have been damaged by poor blood flow. Nuclear stress test. A nuclear stress test helps measure blood flow to your heart muscle at rest and during stress. It is similar to a routine stress test, but during a nuclear stress test, a radioactive substance is injected into your bloodstream. Chest X-ray. This test takes images of your heart and lungs. This is to look for other conditions that might explain your symptoms and to see if you have an enlarged heart. Blood tests. Certain heart enzymes slowly leak out into your blood if your heart has been damaged by a heart attack. Samples of your blood can be tested for the presence of these enzymes. Coronary angiography. Coronary angiography uses X-ray imaging to examine the inside of your heart's blood vessels. It's part of a general group of procedures known as cardiac catheterization. Cardiac computerized tomography, or CT scan. An X-ray tube inside the machine rotates around your body and collects images of your heart and chest, which can show if any of your heart's arteries are narrowed, or if your heart is enlarged. Cardiac MRI. In a cardiac MRI, you lie on a table inside a long tube-like machine that produces detailed images of your heart structure and its blood vessels. Treatment. If lifestyle changes alone don't help your angina, you may need to take medications. These may include nitrates, aspirin, clot-preventing drugs, beta blockers, statins, calcium channel blockers, blood pressure-lowering medications, ranolazine or Ranexa. Medical procedures and surgery. Angioplasty and stenting. During an angioplasty, also called a percutaneous coronary intervention, or PCI, a tiny balloon is inserted into your narrowed artery. The balloon is inflated to widen the artery, and then a small wire mesh coil, or stent, is usually inserted to keep the artery open. Coronary artery bypass surgery. During coronary artery bypass surgery, a vein or artery from somewhere else in your body is used to bypass a blocked or narrowed heart artery. Bypass surgery increases blood flow to your heart and reduces or eliminates angina. It's a treatment option for both unstable angina as well as stable angina that has not responded to other treatments. Thank you for watching our video.
So you got your heart, right? And so your heart is sitting in your chest, and it's this muscular pump that will pump blood throughout your body. So it needs to pump blood to all the places in your body. And it actually does a lot of work. It pumps about 100,000 times a day. I'm not making that number up. It actually pumps, if you take the average heart rate, which is about 72 beats a minute, and then you multiply that through for a day, that ends up being about 103,000 beats per day. Right? So it's this really hard-working muscle, this really hard-working organ. And what do hard-working muscles need? Well, just think about the last time you went on a run or climbed a fence or did a backflip or whatever it is that you do to get your muscles working. They need a lot of oxygen, right? What did you feel after you did all this exercise? I mean, you were probably gasping for air, you were panting, you were just, at least you were breathing heavier, right? And the reason for that is because your muscles, you've used them, you've exhausted them a bit, and now you have to pay back oxygen, right? You have to give them oxygen. Your heart is really no different. You might be thinking, well, the heart is getting access to all of the blood that it pumps out, right? So doesn't it just get like basically an unlimited supply of oxygen from that blood? Well, it doesn't actually. So let me actually draw this for you in cross section. So we're going to take a section through here, and we'll blow it up right here, and you can kind of see right here that the walls are pretty thick. And so the oxygen in the blood flowing inside the heart, it can't actually reach all the way across the thick heart muscle wall. It might be able to get to a little bit of the inner section of the wall, but it can't diffuse across the whole heart muscle wall because it's just too thick. So we have a solution for that, actually, and this solution is the coronary arteries. And the coronary arteries run on the outside of the heart. So here's the heart. You can see this person's right coronary artery, and you can see this person's left coronary artery, right? Actually, this is actually the left anterior descending artery, which is a branch of the left coronary artery. So again, these coronary arteries are the solution, right? They bring copious amounts of blood to the heart muscle, and they feed it enough blood to do all the work that the heart needs to do. But sometimes they can get diseased, and so coronary artery disease is one of the problems that can go wrong with the coronary vessels. So you may have heard the term clogged arteries to describe coronary artery disease. And why they're called clogged arteries is because there's this buildup of fatty substances that's almost like plumbing being clogged. So let's actually draw this out. So here is here's a close-up of the coronary vessel, right? So we have one wall there and the other wall here. So here's your blood, and here's some components of your blood. So you got your red blood cells, and here's some cholesterol, and here's some white blood cells, and when the cholesterol is sort of flowing through your blood, and it comes across a bit of damaged blood vessel wall, the cholesterol thinks, hey, that looks like a pretty cool spot to hang out. And so the cholesterol actually will start to deposit inside the damaged walls of your blood vessels. And the white blood cells don't really like this. So the white blood cells try to follow in after the cholesterol to get rid of them, to get them out of the wall. And that kicks off this big inflammatory process called atherosclerosis. And that just means hardening of the blood vessel, because this whole process over time makes that blood vessel wall become hard and stiff. And unfortunately, during the process, a lot of the white blood cells die. So the cholesterol can just keep depositing in there. And the cholesterol in the white blood cells sort of create this fatty bulge called a plaque. And over time, the plaque will start to bulge into the vessel. Why is that a problem? Well, I mean, blood needs to get through, right? If you've got this big bulge in the way, how is blood going to get through? So for the first little while, I mean, blood can get through and you won't have any problems. But over time, and I mean, this plaque takes decades for it to build up to a clinically significant level, and that means when you start to get symptoms. So over time, it'll just continue to grow, and then you'll start running into some problems. So again, just to be perfectly clear, coronary artery disease is when you start to get buildup of this plaque, this fatty substance within the arteries of your heart. Let me just make some room here. And why it's bad, why coronary artery disease is bad, is because downstream, later in your life, it can lead to some other heart diseases. So we'll just briefly describe the main ones. And we'll start with one you may have heard about before. We'll start with stable angina. So let's look at this bit of muscle down here that the artery's sending blood to. Well, and let's put our plaque here. Let's say our plaque is here, upstream. When you're at rest, when your heart's not doing too much work, enough blood can get past that plaque and get down and feed that muscle. Okay, so that muscle is, happy. It's getting enough oxygen from the blood that's getting to it, and, it's not feeling any adverse effects. It's totally happy, right? But what happens when you start to